Bonjour, bienvenue.
Good afternoon. Welcome to all of you. It's a great pleasure for us to start the afternoon with a fascinating topic, solidarity and the elderly people in society, with Fabienne BARBOZA, Serge GUÉRIN, and Paul-Alexis, and Myriam KHOMRI. So let's go around the table. There are two strong words, solidarity and the elderly. So I would like each of you to tell me, how do you connect those two words? Because we possibly have different meanings of the word solidarity and the elderly. Fabienne? Thank you, Philippe. For me, solidarity means mutual aid, to be there for the people who need you, to be able to count on each other. And we are talking about the elderly, we're talking about transmission, wisdom, balance, and those words are not contradictory. So for me, it means the younger should help the elderly. And also the elderly to the youngest ones. Yes. For us, solidarity is citizen solidarity. You are going to welcome several people in your home, elderly people, fragile people, and the idea is to recreate that solidarity, which is an intergenerational one. The role of the person who's going to welcome the elderly is to provide some coordination. Territory, solidarity, close, local solidarity, yes. Solidarity is also reciprocity. In the past, the young person would learn from the older one, and it's still the case. But the elderly could also learn from the young one. A grandfather saying, my 8-year granddaughter just fixed my phone in 2 minutes. So it's a mutual contribution. Also, the idea of the solidar selfishness, because when I think I need to show some solidarity and I need to help the elderly, but it's also about selfishness, because I might be the elderly, I will be the elderly in the future. So it is in my interest to show some solidarity with the elderly, because as far as my family is concerned, I'm going to be affected, but I am also going to be affected. Now, we could look at society in a different way. We could consider that man is a wolf for men, and there are many people thinking like that, and in a very brutal way. Interdependency, that's what it's all about. I might need the other one. I'm thinking about Teddy Runner, somebody who looks like me, you know, same skin color, same size, same weight, 1 meter higher and 100 kilos more. But since he's 14 years old, he is being assisted by a psychologist who might not be as strong as he is, but he's helping him. So we need the others. We need the others to travel. We need the others to get some food. So if there is no solidarity, society is going to collapse. The minister, what do you think? Well, I think many things have been said, like reciprocity, mutual help, and it's important. But I think there is an issue of the maturity of our society as far as aging is concerned. With you, Philippe, with Fabienne, I have looked at, you know, after looking at things, we've seen that there is a lack of consideration, and because those jobs are not being valued, they are mostly women jobs, and it's also about the way you look at the elderly. We're living in cultures, in societies that are obsessed with performance. The elderly, in particular, they feel that they are socially useless and economically useless. But that solidarity towards the elderly is something that we need to develop. thanks to the way we look at professionals who are working with the elderly on a daily basis. So it's not completely collective and inclusive, but we need to work on it. So we need to change a company which is more oriented on assistance to work. Well, a sustainable social policy. Sustainability is not just for the environment, but it's also how you repair the damage of the past, but how do you anticipate them? In hygiene, it's quicker to clean an elderly to help her rather than to help her to do it. But what you want to do, you want to help her to do it. Talking about meaning and jobs, I'm turning to you, Fabienne. In all the works that we've done, thanks to Myriam, there's another way of thinking about the work. You need to be more responsible, and you need to show some solidarity between professionals. Could you please explain to us what is this approach? What is this different way of working? The first thing I'd like to say is that in this working method, there is a lot of autonomy for the aides, so they don't have anybody behind for these domestic helpers. They don't have anybody behind on their back telling them what to do. You know, the idea is to be autonomous. We do recruit our future colleagues ourselves. So it's not the executive who is going to tell you, I have recruited somebody. No, the person is going to recruit the person, and we're going to test the empathy, the job on the field. And once the person has been recruited, the person will be integrated. So there's like a tutor who is going to assist the person to explain what the person should be doing. So you're not isolated when you start working. And then the visits that you are going to pay to the future beneficiaries, we don't have somebody who is going to come and pay the visit with us. Who is going to work at home? The domestic helper. So we do pay the visit ourselves, and we tell the person what we can do, and we ask the person's needs. We ask the family to let the person express themselves, even if she has cognitive disorders, because then we'll find ourselves alone with the person. And this is creating trust. The person knows who is going to come and ring the bell just to say, my name is blah, blah, blah. No, you know, it's ice-breaking, and so when you start working, the person will be reassured. And then the timetable, and in fact, we don't have to run from one neighborhood to another. We work as close as possible to the people. When we come to work, we are fresh and we have no transportation issues. We know exactly who should be, who should come, who should replace. So it's a little bit like a revolution. It's a big revolution. It's a Dutch method. How is it called? BARBOZA, I think, is the name of it. I'm turning to you, Myriam. In view of all the works that you have conducted, in order to show solidarity to the elderly, we need all the caregivers to also show some solidarity. Do you think this is completely marginal, or there's a willingness to change things? Because solidarity is about being as close as possible to the patient, because the domestic helpers are the ones that are the closest. Do you think it's Taylorism, or there's a willingness to be as close as possible. We conducted 150 hearings, and we paid visits to the field. And what we've seen, there was a lack of recognition, and the helpers are earning 802 euros per month, and their transportation, they spend a lot of time in public transportation. So it will go through the professionals. Now, what are we asking them? We are asking hygiene, treatments, assistance, but also kindness. And the question that we should ask to ourselves, are we kind towards those professionals? Because the service quality is connected to life quality at work for the professionals. When you have an elderly man who is telling you, do you think it's right? Do you think that it's normal that I had to show my buttock to 27 people this month? There's an issue of dignity. So within the nursing homes or at homes, we need to change things. We need to analyze the business model of those new organizations. Sometimes you have 20% of absenteeism, and with these new organizations, the fact that they're closer to the teams and they're autonomous, they are meaningful jobs. The organization as it stands today, does it value them? The answer is no. So we need to value this new type of organization, the impact on life, the service quality, and we need to build a more consistent policy. So solidarity means that we need to give the floor back to people working locally and to the elderly. There won't be any solidarity if people don't talk to each other. Yes, absolutely. We used to say, yes, you could end up in that sector by coincidence, but you won't stay there by coincidence. There are people who don't find any meaning. But people are saying it's worse than just a tin, because it's you have to give meaning back to the job, and you cannot assist fragile people if the helpers are fragile themselves. And that issue of autonomy and meaning. You know, sometimes we talk about the society of despise, because sometimes I think I shouldn't have done that the way I did it, so I'm not happy about it. And you have to listen to people. Well, it's not the right thing to do, but let's look at why they're doing it. Maybe because they used to do it like that. So you shouldn't let them alone to think about it. You should confront yourself to other people.
So imagine someone who's, who's presenting a neurological difficulties. Well, we said, we say, well, to the elderly people, if you're over 65 years of age, then you need to do this and that, and you can't do this and that. So people start thinking, okay, they try and decide for others, even if these people find it more difficult to express their views, they nevertheless remain citizens. We are in a society, we live in a society where people live longer, but, we need to accept aging, the development of a society where seniors are in growing numbers, have chronic ailments, or might have, disabilities and that fact. So people need to feel comfortable. And whenever they say, well, personal support services, personal care, again, you have to take into account the human element. You need to recognize that, okay, someone who's fragile, how can they recognize and people wearing masks, taking care, providing care? And so you need to think local. You need to think people that these persons know and are familiar with. So you need to devise a system around that. And from a cognitive standpoint, a system that is about making sense, giving a new purpose, providing local care. So what is this with this notion of family-driven care? What is it, by way of, how does that give a purpose to a job? Well, our approach is about a family-driven way of welcoming. This is about the opportunity, giving the opportunity to someone who has disability to be accommodated in a family. Our role is to cross-fertilize this kind of structure across the territory in France, so people can just live within the family, and so maybe in the local areas or so you can create or recreate an environment from a social, creating a friendly environment. What we've created is that in these environments, from 1 to 3 people can be accommodated. They are taken care of, and the left to be paid is 1,200 euros a month. And so what is their profiles? Tell us about their experiences. There's typical cases, 91% of people who receive those people within the schemes are female, and reach the later part of their career. And according to our soon-to-be-published study, we have about 65% of those people receiving people with disabilities who come from a social, social background. So these people don't commit to this, don't get into this for economic reasons. But are you talking about, no, I'm talking about typical profiles of people who receive people with disabilities who come from the nursing background, let's say. And we're talking about time. They give their time. So we're talking about the significance of time. And so why is, and there's going to be people who can be taking the time to look after these people. This is a real solution, a real possibility. And I believe that the difficulty, and we can see this when we get contacted as to put together such schemes, there's a kind of a people, given their place. And no, in actual fact, we want to give them the opportunity to take the place they want to. Should there be any, need to prepare dinner or whatsoever, these people will take the place they want to. We're not going to give them that. We are going to give them the opportunity to choose, to decide, to give them the capacity to decide, to choose. And that's empowerment. That's what autonomy is about. Otherwise, it doesn't make sense. You said that people are 50s, 55, they have their own family. How doesn't that shake the family structure? Or is it a source of a breach exchange and a breach experience? At some point, and it's quite funny to see that children who entrust and confine more in people from outside the family, and this is, so the reality is that the people are really embedded in these families. The family becomes an anchor, and so you don't take such a decision lightly, and it's just very subtle. There's a real family-driven consideration, and people from a medical, social background were involved, the husband, the children. There's a philosophical project behind it. That's maybe my children still live at home, and so 1 in every 2 families live with their children still at home, so there's intergenerational transmission here. And so you think, well, you're talking about these are accompanying persons, these people, these women who come into these types of projects to welcome people with disabilities within their families. It's going to be adding a rich source of exchanges. It is a bonus. It is an opportunity. And there's still. It is. At times, this matter is perceived as a burden, or no. Let's remind people that okay, you've got parents, you're happy, they're still alive. So, I think that's not bad, isn't it? It's got a cost, yeah. But let's say for people over the age of 46, well, you remember that back in 1900, you were all dead because life expectancy was way shorter. So welcoming these people is about widening up the scope. It's not about losing rights, but these children discussing with, those elderly people who welcome in these families. Well, maybe one of these elderly people will have maybe the skills to explain, to tell children how it is. And I remember that I visited Brussels recently, and I ended up with looking at a cartoonist. Ended up at an exhibition center, get a cartoonist at Peyo's work. Peyo, the author of The Smurfs, and he created the character of Mrs. Adolphine, an elderly woman. And what's happening when the hero of this cartoon is sick? He becomes very sad, he loses superpower, and the first person that he goes to see when he's not doing well, and he's Mrs. Adolphine, the elderly lady. And this is what a family, is about, and this particular scheme is about. This is a source of rich discussions, and you can't do these jobs if you can't create, if you can't connect with the person you support, elderly people, amongst others. And when for someone who has a cognitive disabilities, 2 hours is not enough, especially with someone who needs to be set up for when you need to prepare someone for sleep or dinner, or it takes a long time. But let's imagine someone who's a very depending person from physiological standpoint. We don't want to rush into taking care of people. In terms of, we don't want to rush the delivery of care. We want to take the time that's needed to look after them properly. I like the method of this family project, because many people in France want to stay home as long as possible. and if you can't do this and that, and if you have an alternative to put these people in other families that can look after them, so for these people to handle, to really enter the later stage of their life as a family, within a family environment, that's great. It's high time to enhance and get more familiar with those delivering home care. This is key. I think the notion of time is key. The notion of time is key because everything is timed. And time is, you said that this was a very tailored method, working like in a manufacturing line. That doesn't work. But this is a reality. That's what's happening out there. This is the number of labor incidents, that's 104,000 employees, because on average that's 34 per, whilst the average in France is 34 for 1,000. So there's really high numbers there. The accident rate, and one of the points here is really the absenteeism rate is very high. So if you cut absenteeism, because we have a strong family-driven policies, you get a return on investment. So what is the first thing they want? They don't want to choose between doing something quickly and doing it well. And that's what's happening. Some of the local authorities are still, taking measures, but on average, people, still in some cases give 15 minutes to deliver care to elderly people when you come in the morning. Some of the structures who've adopted this new ways of going about their jobs, that's not what you've described. Is not what is generally practiced in these countries. There's lots of people who drive for miles. They still have fragmented schedules. They have people who, I don't want to give you an apocalyptic image of these types of jobs, but the expectations are very high. And despite in the crisis we've just gone through, and getting masks from pharmacists has been quite a struggle. So we had to fight for it. I think that these jobs really value is linked to pride of doing these jobs. So there's a delta, there's a gap between a deep sense of purpose and the invisibility, the lack of recognition in the public sphere within society as a whole. So this is something that why 15 hours certification, so different qualifications, how over dinners can say, well, okay, I'm a social assistant, I'm a social worker, this has to be, these jobs have to be enhanced, have to be better recognized, pay obviously has to be reviewed upwards. There's lots of things to be done there. In states and local municipalities, that things are moving faster, indeed. People don't want this to cost too much. 30% of lots of local authorities don't respect appropriate compensation, appropriate benefits. Even mileage reimbursements, no career development opportunities. And again, this is about delivering. This really influences these care delivery services. So the key here is these all of these factors I've described. COVID, has that shaking? Has that changed your practices? Indeed, it has, and it has revealed solidarity, tremendous solidarity. Go shopping for elderly people, going to get their drugs at the local pharmacy. But what COVID changed in the way we work is that people would work way more. They wouldn't get into transport, into public transport, because masks are perceived as a real struggle. How can we work with these people because they can't understand why we have masks? And yeah, we can to greet them. It's very family-oriented. There's a link there, it's reassuring and all. So when we say, okay, today, Philippe, I can't give you a kiss because I can't, because there's COVID. It's a flu. It's a killing. It kills people. And we wear masks. Remember, we have to wear masks. And
je me présente à la pharmacie parce que on a reçu le circulaire qui dit qu'on a le droit d'avoir 9 masques.
Memo that says, well, we're allowed for 9 masks. And then people would say, no, you're nurse, the masks are reserved for physicians, doctors, and that's it. And people would deny us masks. However, and it was very frustrating because we had to wait in line to get our masks. And I would even, get there before the nurse. And I haven't got a mask. How do I work in with such an environment? So on TV everywhere, you would get a memo according to which, as an assistant, as a home assistant, you would, as a home helper, you wouldn't be given that recognition. And at the start, people didn't act in the spirit of solidarity. And then slowly, things changed, but it did take some time. So young students, they discover such professions, and what has been going on, has that boosted interest? Have you created people that have this call to serve? Well, I thought, well, they want to step outside. When you see a grandmother, grandfather, and staying at home, stuck at home, you want to help him or her. You want to help. And these are, these services were delivered by young people, not female workers who reach the end of their, or the latter part of their career. So this is really comforting to see that the young have spontaneously answered that call. You didn't wait to be taught or to be compelled to do that. It's just, it came naturally. I really appreciate that. I think it's solidarity, the elderly, and solidarity. Isn't there a generational theme there? It's not about the intergenerational, but there's real solidarity there. Isn't there a conflict between today's generations of people in the 50s, 60s, to act in solidarity of the elderly people? Was the younger generation more careless or feeling freer? Do you think that's the same across all generations? Or not? Well, as is often the case when we don't know how to oppose people, said, we'll find the thing about generation, but the opposition can be social, cultural, in value. And people believe in it because this is their day-to-day experience. It's like, okay, this guy looks like my grandfather. It's like granddad. And this really part of the young, this is what I felt. Said, well, the young didn't wear masks. That's what's happening is because of them. This is a top-down opposition, but okay, maybe these young students never talk to Mrs. Denise, next door, and now they went to get their shopping, and that's what happened. So from a period, I hate families, and now we've entered this period of solidarity, and this is about the notion of family, from the very definition there. That's something that's pretty strong. I think COVID, this incredible COVID-driven catastrophe was also a source of in all periods you have brilliant people, you have really bad people, and we've seen, people who came to help, far from opposing generations once against the other. This strengthened these connections. Two moments in terms of awareness raising. Okay, jobs, working is not that easy. There's 3 months holidays. There's people being criticized in public service. That's something that's we all of a sudden they played a key role in combating COVID and the healthcare sector, and then these various forms of solidarity. And there's a symbolic purpose here, this transmission. The grandfather, grandmother, he really pass on the legacy and share their personal experiences. And then at some point, well, the over 70s, 80s, are we talking 1 million? No, 6 million. Going forward, there will be 12 million of those people. There's awareness. People became more affected. We're not talking a minority somewhere. We're talking several million people. It's going to be booming. It's going to be an increasingly great number of those people here amongst the general population. And this is how you look at it. If you tell people you're wrinkly, well, you need to, or if you're a respectable old person, it's the way society look at this. For these jobs to be enhanced, to values to be enhanced, there has to be communications. It's not about working with the wrinkles. It's about enhancing the value of those jobs. There may be jobs that can be of interest to you because in the way you are with people, that could fit in well. It's about enhancing emotional criteria, emotional intelligence, as opposed to going beyond management control.
Effectivement, j'ai vu que la Fondation Cordon que tu présides a sorti un rapport extrêmement intéressant sur la notion de l'utilité de nos aînés. Extrêmement important, parce que ce mot utilité, solidarité, utilité, c'est vraiment le mot finalement où il y a une association.
This is really key there, and all of us, irrespective of our age, our function, our health status, we need to feel useful. And most disabled people, the person with the greatest disabilities needs to feel useful.
C'est paradoxal, mais pour 2 raisons. La première raison, c'est
que what's happening here is that those people received in our families did not necessarily feel the weight of lockdown because they stayed within their usual environment at home. No virtual change there. And the second aspect is that there's been an intensification of the connections with the children and grandchildren. So part of the people who didn't have any, who stopped contacts with granddad and grandma, is it, well, because the media talks a lot about this, realized that as granddad and grandma using digital tools have been able to reconnect with the families, with the person who was received in these families. So that radically accelerated connections and strengthened connections within family, between families, the natural family, and the family who would receive these people. News, updates. We're talking about generational gaps. There's grandchildren and are taking care of those and topics. And we've assessed that there's a plus 33% of video connections between grandfree children and people who are received in these families. So it's quite a positive, despite it all, it was quite a positive period. Very positive from a social standpoint. What about this COVID period?
Ça changerait un certain nombre d'éléments, de recommandations que tu as faites pour rajouter, renforcer un certain nombre de points. Il y a des points nouveaux qui sont apparus. Comment ça réinterroge?
C'est le rythme. Il faut accélérer.
It's just we need to move faster. This COVID period showed that we need to accelerate. We need to move faster, and we needed to change faster. And testimonies from stories from social helpers in working elderly people, that people applauding clapping their hands at 8 were just for nursing staff and doctors, not for them. So there was this strong reaction against this lack of recognition. So in the report that I was describing, 59 measures, like the competitive exam to access the helpers. We worked with the regions in France yesterday. So there's more such helpers in schools, he says, and more people interested in this profession as home helpers as well. And then we came to a period where human health was the priority, human life and human health. Well, that might have created some callings. We need to work on this health think tank, and this has allowed to create for some of the healthcare professionals input in terms of benefits, notably with private sectors and non-profit making sectors, but this remains the issue of home helpers, and there we have to wait measures in the near future. So the vast majority of the elderly live home. And when we look at figures, most of them, live at home. There's a minority living in elderly residential homes. So it's about enhancing the qualification of those home helpers. So we have people with cognitive disabilities. And we need to have a training that allows to really prepare for these. And to this, it means that support, what makes a connection what it is, has to be enhanced. And we need to improve the image of these, the image of this value. So medical social has to be brought together more closely with the sector of healthcare. So taking care of what home helpers have to say. And I think you just don't hesitate to be So I think this is a major stake there. So the feeling was to be at the bottom of the social ladder, and to suffer from lack of recognition, to be good enough, and whatever is said is not taken into account.
J'ai fait mon introspection en travaillant avec vous, mais je me suis rendu compte que
self-reflection and
alors la manière dont tu t'occupais des aides-soignantes
et des auxiliaires, mais j'ai honte de moi. J'ai honte de moi parce que je me permettais de faire des interruptions de tâches. Comme si moi je suis le docteur alors que on rentre dans la chambre, vous avez tué ça. Et voilà, et je peux déranger. Et j'ai vu que dans un élément de stress, on a travaillé beaucoup sur l'activité avec Nehs et la ménage, on a travaillé sur les éléments de stress. Et bien, un élément de stress majeur, c'est les ruptures de tâches. Nous sommes des pourvoyeurs de ruptures de tâches, les docteurs, absolument, c'est incroyable. Et deuxièmement, quelle parole on donne? Car on parle éventuellement avec l'infirmière, avec l'interne, mais la parole de la personne qui est au plus proche. Est-ce que on fait les confidences? Et avec en plus quelque chose que j'ai découvert, c'est que finalement, en plus, le malade, il va dire un peu les choses à l'infirmière, au docteur il ne va pas oser, il va engueuler, c'est l'aide-soignante qui en prend pour tout le monde. Car que finalement, le mécontentement potentiel, il s'exprime forcément aux gens avec qui on est le plus proche. Et je pense que tu poses un problème de fond majeur, c'est cette solidarité au sein même des professionnels et entre le champ du sanitaire et du médico-social.
Et pour une meilleure prise en charge.
Mais en fait, il y a déjà un gros problème, et Serge l'a souligné tout à l'heure. Il ne faut pas envoyer n'importe qui dans des métiers de proximité à domicile. Ce n'est pas possible.
Home help is not for everyone, or anyone.
Arrêtez dès que quelqu'un n'a pas de travail. Arrêtez dès que quelqu'un est licencié
whenever someone is out of a job
pour rester à l'école parce qu'il est en rupture scolaire. Allez, on va t'orienter vers les métiers de domicile, on va t'orienter vers les métiers des personnes âgées.
Home helpers,
possible de continuer comme ça. Déjà, il faut commencer à trier les gens qui ont de l'empathie, qui ont de la patience, des gens qui savent
identify people who have empathy, who are patient, and then direct them to these jobs.
C'est pas un boulot alimentaire.
This is not just a job for just paying the bills. It's not. People don't feel that the values is not hence. It's just that, as a home helper, you pay for a service, and when the job is not done properly, because we put into this job people who don't like this job, and they do it just to make ends meet, and stop directing the wrong people to this job. This is a disaster because we have to suffer something that we don't have to.
Ça suffit maintenant.
C'est clair, Fabienne.
It's 2020.
Et d'ailleurs, dans le rapport, d'ailleurs, dans le rapport, ce qu'on a préconisé ensemble, c'est qu'on mette en place des
In the
plateformes
report, what we recommended today and together is that we're putting real. We were going to be testing the know-how to be of these people, and this is then that will take people towards training. Otherwise, it's not going to work. We're going to be paying training for people who are going to be giving up these jobs because they won't be in the right place.
C'est des métiers de
la relation, et c'est pas le problème technique. Le technique, c'est le plus facile.
Well, the technical aspect of it is the easiest. For those who train to work in health facilities, I'm telling them, first of all, go and have a look. It's like volunteering. People want to be volunteers. I'm going to help the others, but who are the others? For example, you might not feel comfortable. If you're not comfortable, people are going to say it. So, something that needs to be valued is emotional intelligence. Some people are not done for that. So we don't value the right thing. If there are two people who are doing the wrong job, the 6 other ones are going to pay for them, and there won't be a good spirit. So you need to share a maximum of common values. We're talking about solidarities, local, territorial solidarities, but there's one solidarity that we've not addressed, which is fundamental, and I'm being faced with on a daily basis, is the solidarity between the public and the private sector. We've been in existence for 3 years. We have 5,000 people welcoming families, and I asked for some masks, and I'm still waiting for the answer. We got a letter a month later, but I'm still waiting for the answer. Can they have some masks? And because the ideology is they are working in the private sector. We are a social and solidarity company, but it's good to create social value. Unfortunately, today we could be faced with an administration which is blocking. We do have 5,000 people working in our group, but we know that to make connections, we could go up to 50,000 family helpers. There are many people working in nursing homes and others that are staying at home, but they need to be assisted, and very often they are isolated, they are alone. And we need to work hand in hand with public players. So solidarity is also at that level. Sometimes I could be frustrated. You mentioned Europe. In France, we see that there is a potential build-up. This family welcome, is it very French, or are there any European countries working on it? France has the most legislations. We do have systems in Italy with people coming from Eastern European countries coming to look after elderly people in Italy before they go back to their country, but it's not necessarily very official. And we are going to go to Germany next year because we have the same needs, and in Poland because we have the same needs. There is a middle class, an emerging middle class, which is aging,
les établissements collectifs ne sont pas forcément la solution à tout. On travaille main dans la main avec
nursing homes, the collective nursing homes are not necessarily the solution.
Et donc en Allemagne, en Pologne,
And in Germany and Poland, there is also a potential. And in England, the labor law is such that the people are going to the homes and they will assist the elderly for 24 hours. But there is a labor law which is simpler.
Est-ce que je voudrais juste dire, on parlait d'interdépendance tout à l'heure, puis tu
We were talking about interdependency, and you were talking about the opposition between the private and the public sector. And sometimes we tend to oppose homes and nursing homes. But this is stupid because it's a continuity.
Parfois, se dire, en journée, j'aimerais bien être accueilli
Sometimes
dans un
you
lieu,
might think,
et
okay,
des fois,
I'd like to be in a place during the day and then
ça
go
peut
back
être
home in
pendant
the
tant de
evening, or
temps,
the
un
opposite.
endroit ou un autre. C'est comment on arrive à faire quelque chose de plus,
So in fact,
plus souple, de plus
how
simple.
do you manage to do something that is more flexible? Another study with Ipsos and the Korean Foundation was looking at asking people if you will find this type of services in a nursing home. Are you going to go there? And we put it in hairdressers or in veterinarians. And 75% of people said, yes, I could go to the nursing home for that service in particular, or to go to the restaurant. And well, we're talking about the yellow vest fronts, but where, you know, there's nothing left. But there are also we could also be open to other things. We could have a doctor. There is a project like that. You know,
Philippe, les médecins ont plutôt envie dans les logiques de salariat et tout ça. Être salarié par la maison de retraite, mais pouvoir aussi faire des consultations pour d'autres.
Be nursing homes employees, but then they could also
sont un peu complexes. Mais je peux me retrouver auxiliaire de vie.
But you could be a domestic helper, and then at one point you will work in a nursing home. Sometimes you will work in private homes.
Il y aurait plus de fluidité à trouver.
There might be more flexibility. It's what I was mentioning with Sophie Cluzel. Should we allocate funds to people or to structures? At the moment, we allocate funds to structures. And maybe we could help people to choose. We want our elderly people to choose. Don't you think so, Myriam? The governance of the sector is a bit specific. There are a number of federations, 7 collective bargainings, and the département, the government, the regional health agencies, the nursing homes, the administrative and the financial system is meaningless. So a sustainable social policy would be to revisit everything and departition it. We know that a full-time job in the public, 35 hours full-time working for the public at large is not possible. So we would need part-time jobs and in nursing homes. We don't only need people's needs, but also what they want to do, their life. I'm looking at Fabienne because she is a domestic helper for...
On parlait de toi, Fabienne. Il y a
to make people like what they're doing.
On a des hommes.
We do have men.
Pas beaucoup.
Not many of them.
Il y a aussi un autre problème.
There's another problem.
La plupart du temps,
most of the time, when
when
we introduce somebody or when we come with a man, the family says, no, we don't want any men going to my mother's. But sometimes we come with a man, and the mother is really happy. She's in love. She wants to look beautiful. I think it's more like self-consciousness. My mother is aging, and but what we're saying is, it's your home. You can choose. If we were in the hospital, you wouldn't be able to choose the caregiver. But here, we will respect your privacy. He's not going to tell anybody that he's seen you naked. So He's not going to see a mother like a naked person. He's going to look after her and respect her. And there are more and more men who do it, and young men.
Absolument.
We need to continue and mediatize them. Another question. How could we simplify the social health treatment of the elderly? We could have spent the whole day on this. How could we improve the fact that it's all scattered? We've talked about being local. In northern countries, it's at the town level. Myriam, I think you will agree with that. We don't need to have 50 of them. Myriam, and I will leave you to the conclusion. I think everybody should make an effort. The government, the department, and all the professional branches. Everybody should make an effort. And in conclusion, I would like to start with Simone de Beauvoir's sentence, a book about the elderly. The meaning of our life is about what we can expect. Let's recognize ourselves in that old man and that old woman. If we want to recognize our human condition, let's not be indifferent.
Merci beaucoup. Merci à vous tous. Merci à ceux qui nous ont écoutés, qui ont envoyé des questions. Vous avez une pause et le prochain débat à 16h.
Now we're going to take a break.
L'État,
the next panel discussion will be at 4 o'clock.
On vous souhaite une bonne fin de CHAM. Au revoir.
Merci. Au revoir.
Thank you. Bye-bye.